Superficial scan of the anterior abdominal wall. We want to evaluate this patient before going in for peritoneal dialysis. So what we want to do now is look at the abdominal wall under the superficial scan to look at vessels that can be on the way of our catheter insertion. So we usually put this catheter in between midway between the umbilicus and the pubic symphysis. So if you scanning through that point now, we see the two rectus sheets that we can see, and this is the inferior hypogastric artery here, and so we want to avoid inferior hypogastric artery. This is it here. We want to avoid inferior hypogastric artery. This is on the left and on the right, so it's on that one here on the right. So we want to avoid this vessel during the procedure. Okay. The same here. We want to avoid it. So on the average, we have to look at from the midline, look at what 2 centimeters to the left or to the right. So if we do that, we can see that there is no major vessels on that point. So when we go in for PD catheter insertion, that's the caution we're going to take. So we want to avoid, this is what we want to avoid. You can see how blood is flowing through the inferior hypogastric artery. So at this point, we take our measurement, ensure that we don't get to this point, which is about 3.6 centimeters away from the midline. So this is the initial assessment. The other thing you can do in PD assessments, pre-catheter placement assessment, is also to look at the depth that you can go with your. So we take that on this. So look at the depth, the pelvic floor. So we can see the bladder. So this patient has an acute renal failure, so we can't really so we scan to the pelvic floor from the surface to the pelvic floor. So this is it. So we can measure distance from the superficial area to the pelvic floor, which is somewhere around this, about 8 centimeters. So these are some of the pre-catheter placement evaluation we do. And of course, we assess the peritoneal cavity to be sure that there are no hernias, the bowel loops are okay, the peritoneal space are good for us to put in our catheter. So we go ahead now to the theater, having explained to the patient the procedure. We go to the theater for catheter placement. So we can look at the recess, look at these renal angles, these are free. This is free, so we go ahead for the PD placement, catheter placement. So we can have effective peritoneal dialysis.